So this is video 6-126, bimanual thumb, index radius, and ulnar shear, anterior posterior, posterior to anterior glide. So this is going to be loss of anterior to posterior, posterior to anterior, accessory movements of the radius and ulna. So patient's going to be seated, palm's going to be facing the ground. Doctor is going to be standing on the same side as the affected arm facing the patient. Segmental contact point is going to be distal radius and ulna, and that was segmental contact point. Contact point is going to be thumb, index finger grasp on both sides. So inside hand is going to be grasping the distal radius, outside hand is going to be grasping the distal ulna. So in order to do this, we assess posterior to anterior, anterior to posterior. When I do the ulna, I'm stabilizing the radius and vice versa. So on this one, I'm going to demonstrate for ulna. So I'm assessing posterior to anterior right now, and then I'm going to assess anterior to posterior. I feel loss of joint movement, and then it's just going to be a flick in the direction. So my vector for this one is anterior to posterior, and then I go down, posterior to anterior, stabilize the radius, flick, and then come back, reassess both anterior to posterior, and then I would do the same thing for the radius.